Hello everyone, welcome again. So today we are going to talk about an important topic, and that is treatment of type 2 diabetes mellitus. So basically we have two options available to treat diabetes mellitus type 2. One is drugs and the other are insulins. Drugs available can be classified into various categories. These include the oral hypoglycemic, and these are the drugs that are associated with hypoglycemia, and it is a very dangerous side effect of hypoglycemia, because almost all of you know that hyperglycemia will take time to kill you, but hypoglycemia need few minutes to kill you. So oral hypoglycemic, there are two classes of oral hypoglycemic. One is sulfonylureas and the other is meglitide, and the main side effect associated with is hypoglycemia. So various drugs available in sulfonylureas groups include glyburide, glimepiride, and glipizide, while meglitide include repaglinide and netiglinide. Other side effects associated with sulfonylureas include SIADH, the syndrome of inappropriate ADH secretion, and photosensitivity, but these are not very common. Then we have drugs that are insulin sensitizer, and basically what they do is they decrease the tissue resistance to insulin, and these include drugs like biguanide, which include metformin, and thiazolidinedione. Of course, they include the pioglitazone and the rosiglitazone. The main side effect associated with metformin is GI upset, and these include anorexia, diarrhea, vomiting. And to minimize this side effect, the patient is asked or advised to take metformin during meal or with meal. We have extended release form available of metformin, and they can be given once daily. Another important thing that should be noted for metformin is its side effect of lactic acidosis, and we cannot use it if the patient has creat clearance of greater than 1.4, or patient is in congestive heart failure. Thiazolidinedione include pioglitazone and rosiglitazone. They are also insulin sensitizer, and they decrease the tissue resistance to insulin. The main side effect associated with thiazolidinedione is weight gain and fluid retention, and so you cannot use it in patients who have congestive heart failure or who are at risk of fluid retention. Then we have drugs like alphaglucosidase inhibitor. These include acarbose. The main side effect associated with alpha-glucosidase inhibitor is flatulence and diarrhea, of course, GI upset. So basically what they do is they prevent the breakdown of complex carbohydrates in the intestinal lumen and prevent its absorption from the intestine. So alpha-glucosidase inhibitor, flatulence is the main side effect, and you should be aware with it and properly counsel the patient about the possible side effect. Then we have another important category of drugs. These include the dipeptidyl peptidase 4 inhibitor, and these include drugs like sitagliptin and saxagliptin. Of course, sexy. So they are euglycemic, and you can use it in patients who are at risk of hypoglycemia, in which hypoglycemia can produce catastrophic consequences, like patients who have jobs that include, like for example, I would say taxi drivers. Taxi drivers should be never given drugs that can cause hypoglycemia, because all of you know that when they are driving and suddenly they have a hypoglycemic spell, then that can be really catastrophic. Of course, you can give combination of these drugs: glyburide and metformin, glipizide and metformin, metformin rosiglitazone. So different combination can be given if the patient HbA1c is not controlled with monotherapy. Then we have the GLP-1 agonist. These include the exenatide, which is also available in subcut formulation. And GLP-1 agonist is one of the ideal drug for patients who have erratic lifestyle, like patient having BMI greater than 35. So GLP-1 agonist can be used in these patients and can be beneficial before trying insulin. The main side effect associated with GLP-1 agonist is nausea, weight, weight loss, and GI upset. Pancreatitis is also one of the recognized complication of GLP-1 agonist. So these are the various categories of drugs that are available to treat diabetes. Which drug to use depend upon the patient lifestyle options. So if the patient is, as I told you, is at risk of hypoglycemia, so don't use sulfonylureas. The best option to start up with is metformin. Of course, you know that when to start these drugs is if the patient has a diagnosis of diabetes, and how to diagnose diabetes required basically two set of two set of blood sugar above the normal if the patient is in fasting, or one set of abnormal blood sugar if the patient has symptom.